Welcome to the fourth episode of What in the Health with your co-hosts, Eric, Rena, and Fatiha. We're excited to present our fourth episode, Environmental Health 101. Today, we will be talking about environmental health in the context of public health practices. Our guest expert for this episode is Dr. Megan Latshaw, who is an associate scientist in the Department of Environmental Health and Engineering, where she also directs the Masters of Health Science and Environmental Health and Masters of Science in Environmental Health degree. She is also a professor at the Krieger School of Arts and Sciences at Johns Hopkins. Her current work focuses on designing healthy communities, connecting environmental health research with the real world, addressing environmental injustice, and improving environmental health surveillance. In our conversation, we briefly introduce and outline the topic of environmental health, cover the current issues associated with environmental health, and discuss how we can advocate for environmental health concerns. We hope that this episode empowers you to take a closer look at your environment and encourages you to learn ways to better take care of it.
To start, we first want to define what environmental health is and how it applies to several entities outside of healthcare. Here's how Dr. Latshaw defined the term environmental health.
I'm not sure you're going to like my definition because I kind of feel like everything is environmental health, right? Because everything in our environment impacts our health. And so, if you think about like the air that we breathe, the water that we drink, the food that we eat, and even the neighborhoods in which we live, that all impacts our health, and that's all part of the environment.
I thought this was a really interesting quote because I think for the three of us, this was a question that was kind of generally coming from us. We didn't really know exactly what we were expecting from Dr. Latshaw and from the field of environmental health. I think the name of it's kind of misleading. When we think of the word environment, I think we tend to think of things like nature, things like climate change, things like natural resources, pollution, and these are all included, like Dr. Latshaw said, but it encompasses much more than that, right? When it says environment, it really means everything around us, right? Not just the natural environment. And I thought that was really cool and really interesting that this field kind of goes so in depth and covers so many different areas and intersects with so many other disciplines too.
I agree. I'm a little bit biased because I did take her class this past semester, but even while I was a student of hers, I remember I'd gone in the first day of her class being like, I'm going to learn how to be sustainable. I'm going to learn about why polar bears are dying out in Antarctica and be like this great environmentalist. And towards the end of the class, we learned about basically everything that she had mentioned in her definition. So that's, to me, was really shocking of an experience. I think when it comes to Dr. Latshaw's definition, something interesting that we talked about is how one event in the environment can be connected to pretty much all the aspects of environmental health to just show how everything is so interconnected. So I know she had given the example of natural disasters and how, although one natural disaster like a hurricane is one specific environmental event at a specific period in time, we talked about how it has the short-term concerns about how is that hurricane impacting your health, both mental and physical, immediately. How is it impacting the environment or the community that you live in, both, in terms of like the actual buildings and infrastructures, but also, with the strength of the community and how it's made up. And then, we talked about long-term consequences too, like access to food and water and just stress and infections that can happen after exposure to floodwaters. So I think that example kind of echoes what Eric was saying about just how interconnected environmental health is. And I don't think that's something we all realize.
I think it's really interesting that the term health is intertwined with the environment. And I think when we hear the word health, we think your doctor, your doctor's office, an illness, when really this kind of health is really broad and it's impacting you in a lot of ways that are not included within, medications or tests. This is really everything around you, and it's so broad. And later we'll talk about how, because this is so broad, it's hard to educate other people, but yeah, this is a type of health that's really not cut in stone. It's very hard to put it in its own box.
Rena, I think you bring up a really interesting point. This might be off on a tangent, but you were mentioning how it's interesting that the environment is such a large component of our day to day lives. But when we think of health, we think of illness, we think of clinical settings. And, as I was reflecting on it while you were talking, I was like, it's interesting how the current healthcare system has kind of dwindled down health into this very almost industrial complex when the environment arguably plays a much larger role on our overall health, which is also something Dr. Latshaw talks about earlier or later in the interview, actually. I don't know. I think this is just something that would be interesting to loop back around on. Maybe we can circle back on this thought later on into this conversation, but it was an interesting thought.
Now that we've set a baseline for what environmental health is and what it means, we next want to discuss current environmental health problems and how they affect different populations.
First, Dr. Latshaw emphasized that climate change is a major problem that affects all aspects of our society.
I think starting with maybe the most important issue of our lifetime is climate change. And it's such a huge issue it's thinking about how can we reduce our impact on the climate, but also how can we prepare, because climate change is happening right now. And so what can we do to help communities be ready for the health impacts of climate change?
I think a lot of us have heard climate change over and over and how it's this doomsday kind of thing. But I feel like we don't really think about our health consequences in terms of climate change. And it's hard because, we hear, oh, the earth is getting 1 degree hotter. It's like, okay, so what? Why is my health impacted by that? But again, circling back into this field in general, climate change can have a lot of impacts on our health. Dr. Latshaw mentioned natural disasters. Those can be influenced by climate change. So, yeah, I think this is a pretty hard issue to kind of connect back to health, but because climate change is so intertwined in basically everything, it still needs to be considered.
I think for me, the politicization of climate change is so bizarre because now I feel like it's that much harder to spread information and research about climate change to know what's going on and what we can do about it. I mean, I remember when I was in high school and we were in I think it was environmental science class or even biology. I don't remember. When I was in high school, I had a teacher be like, oh, I'm not that worried about climate change because the earth just goes through these cycles over the course of a billion years. We're just heading towards the ice age. And this happens. It's a natural process. And I remember being like, you think going into the ice age right now is like completely normal. Like we're just geared towards it. Like, let's just accept it. And I say this story now to be like, there's so many misconceptions, so many theories, just so many arguments about climate change that I feel like people don't realize that it will very viscerally affect you very soon. And it's not something for the most part that you could just snap your fingers and, change. I feel like a lot of people just don't take that into consideration.
Yeah, I think there's a lot of the way we talk about climate change has changed a lot. I think for the good in some ways and for bad in others. I think we talk about it in a lot more large scale and systemic terms, right? Like Rena was saying, it feels like this big doomsday, and it's good that we're talking about what large organizations are doing that's contributing to climate change and how we can curb that and stop that, because that would make a bigger difference than the individual scale changes that I think were talked about earlier in our lifetimes, and a lot throughout history of environmental activism. But it's a thing that is kind of it's global and it's local. Think about what happens when an organization pollutes a river near you. What happens to the local food supply? What happens to fishermen, farmers, and their livelihood? And what happens to I don't know, anything else that's affected by that? What happens to the rain when now it's taking up the polluted waters being absorbed into the atmosphere. And then there's the large scale things, right? Think about the ozone layer. Thankfully, we've done a little bit about that since it was, even worse a few years ago. But like that's a huge, large scale, major problem. And I like the way that Dr. Latshaw said it's the most important issue of our lifetime. I think that's fair, because it affects everyone, whether it's extreme weather affecting you getting way too much snow, and now you can't dig your car out of the driveway without hurting your back. Like that sounds like a mild inconvenience, but that could be a result of climate change. And then of course in the hot areas where maybe it's too hot to farm anymore because your crops dry out. What do you do? What are people eating now? Like, I think just the way that we need to talk about it, and we need to dive more in depth than just kind of this big doomsday that Rena mentioned, because it's big and it affects everyone. And I agree, the politicization is not the direction anyone wants to go, really.
Another thing that I find interesting is how, in most cases, especially in mainstream media, the talks surrounding climate change needs to be very people-centered in order to get people to care about what's happening with the world's climate. Like it needs to be about what's going to happen to your daily commute, what's going to happen to your food supply, like all these examples. And, this kind of brings up the question of like how human society views itself in relation to the world overall as like a system, because it's still like, I can't wrap my head around the fact that like, this is our planet, like our only planet. And yet somehow the only way some people will care about it is if you have very like, I don't know, capitalist language to encourage them to care about like this one home. And it's just something that I've been thinking about, especially since we had talked to Dr. Latshaw, is like, why does conversation surrounding environmental health need to be so people-centered if it's so interconnected with other aspects of the ecosystem, like other organisms or other forms of infrastructure?
I think it's really interesting how we've kind of fallen into this mindset that, oh, I'm not seeing any consequences right now, so I don't need to worry about it. And we kind of saw that with COVID. We didn't really come up with a response until after all the bad stuff happened. And I'm worried that this is also going to happen with climate change, that we're not going to do anything and we're going to sit here because, I can't tell a difference or you can't tell a difference. So yeah, I agree. I think a lot of this does have to be people-centered because you can't really see anything changing immediately right now. But if you frame it in this long-term consequence kind of thing, like how your food supply is going to change, I think you mentioned your daily commute. I think that's a way to get people to be more aware of something that maybe isn't super noticeable right now.
And that's the sad part, is that with most major crises in the world, people typically, especially those in power, don't want to do something drastic about it until it's either too late or it's already caused a significant amount of damage. When you had mentioned the example of COVID, I hadn't even put two and two together until you mentioned it, and just how different leaders have reacted to these very real events that are going on. But again, I just think it's such a shame that we have to center humans around what's going to happen if climate change isn't under control, as opposed to just other aspects of life. But I'm not sure if there's a better way to share and distribute that information on massive platforms and get people to care. So
yeah, I mean, like you're saying, it's a way to get people to care, is to say this affects you and this affects your family and this affects the people in your life. And it's also a way of recognizing that, we're the ones causing this problem. You don't see the squirrels outside, polluting the air very much. Like this is a human caused problem, so it's our job to fix it too. But I think, like you're saying, a recognition, and I think it used to be this way more so than it is now, but a recognition that we're a part of the ecosystem. We fit into the food chain somewhere. We fit into every cycle that is out there in nature in some way. And, viewing ourselves as a part of that, as a giving and a taking, right? Like, sure, we love to take from the environment, but what are we giving back? What are we contributing to it? we need to have those conversations. We need to throw those back into the conversation. And I think using these other kinds of terms, right? Instead of using overly scientific words, I think instead of using political terms too, like there is ways that, it's sad, but nowadays, like there are terms you might have to avoid if you want to avoid making it into a political conversation. But overall, just having conversations, I think that's such a good way to, work on climate change advocacy. And I think, like you're saying, changing the way we view it, looking at different perspectives, I think that's always super useful. And I hope that, Dr. Latshaw and the environmental health field, I feel like they're contributing to that. And, I think thinking about the other environments that we live in, besides just nature is, a good way to keep the same conversations going.
Yeah. And I think to add on to your point, Eric, my hope is that as we continue to learn how to better educate others and ourselves about climate change and learn how to build sustainable and tangible solutions to prevent further damage, I hope that humans don't kind of view themselves outside of the ecosystem and it's outside of the environment, if that makes any sense. I feel like in a lot of instances in academia, you see people and humans being placed outside of this bubble almost because we're the ones studying it. And I think our conversation with Dr. Latshaw was significant in that she kept mentioning how humans can be a part of the environment and a part of the ecosystem because they're equally connected to other aspects of it. So I'm hoping that trend becomes the mainstream way to discuss climate change and other topics in environmental health.
Next, Dr. Latshaw mentioned that where you live, even across short distances, can make a huge difference in health outcomes. Here's what she said about the relationship between health and zip code.
But there's other issues in environmental health that I think we're doing a lot of talking about in the field right now. I mentioned, how your neighborhood impacts your health. And so people in environmental health are now starting to work more and more with like community designers and community planners. There's a saying in public health that, zip code is a better predictor of health than your genetic code. And that boggles people's minds because, we really think of like, if my parents got sick, or died young, then that means I'm probably going to get sick or die young. But really what drives your parents' health and what drives your health is the zip code in which you live and what you're born. Here in Baltimore, there's sort of like this dichotomy that we see. If you live in Druid Hill, which is 5 miles away from another neighborhood called Roland Park, your life expectancy is 20 years lower than the people who live in Roland Park. So less than 5 miles away and a 20-year difference in life expectancy. So we're not talking about small differences. This is major.
I really like this section because it overlaps a lot with my discipline of sociology and a lot of the classes I've taken where we study space and place and, where you live, social determinants of health. That was a term that Dr. Latshaw used in one of our discussions. I just think it's so interesting. And I think it's really important that people realize that this is a thing because we like to say that America is a land of opportunity, where everyone has the same, opportunity to be successful, to rise in social status and economic status and achieve whatever dreams they have. But, this type of study showing that your neighborhood can be a harm to your health, can be a harm to your future, can be a harm to a lot of different aspects of yourself, that runs counter to this, right? And that shows that we're not where we need to be if we actually want to be that land of opportunity. And so letting people know that maybe in their neighborhood, they feel like, their neighborhood doesn't have an effect on them. They live in this nice neighborhood and it lets them do everything they want to do. But there's a lot of people out there who are in spaces where they don't have access to what they need, where the things that they do have access to are even actively harming them. And there's no way for them to leave. They don't have the money, they don't have the resources, they don't have the network, they just have no way of leaving. They don't have the time, they don't have the job opportunities. There's a lot of factors that go into moving. And so when people are stuck in these places, a lot of times there's really nothing that they can do. And so the burden falls on, the city, nonprofits, taxpayers, how can we help these people? And again, it's not just a social issue. It's not just an equality issue. It's a health issue. And I really like that perspective because I think that's one that we really don't talk about a lot at all.
Coming into this conversation without mentioning concepts like racism and redlining is almost like a disservice, because we see how deeply ingrained these forms of thinking are in our day-to-day society. And if someone's like, where's the proof that like racism has led to redlining and that redlining has impacted our health, you go back to what Dr. Latshaw is saying, that zip code is a better predictor of health than your genetic code. And I think, that quote itself is so powerful because it shows you how the foundations of just how our country was made was not set up for equal opportunity, even though that's how it was advertised. And it's really sad to know that even today, communities 5 minutes apart from each other have such drastic health outcomes because of foundational past thinking that created these institutions.
I think it's also really interesting that a lot of the zip code issues come from politics. And the first thing that comes to mind is the Flint water crisis. I'm from Michigan, and Flint is, I want to say, like 30 minutes away from where I'm from. And that was a huge crisis, and we're still seeing the consequences of that. And basically what happened in Flint was that they changed the water supply to the Flint River instead of the Detroit River because it was cheaper. And that money saving decision ended up costing a lot of lives and changed the lives of a lot of people for generations to come. So yeah, a lot of politics involved. It's very hard to just say, oh, like you said, Eric, just move somewhere. It's very hard to say that.
Yeah, I think it's fair to say this was our most political interview. Whether or not we show it in the episode, Dr. Latshaw had a lot to say about, the state of political action on different environmental issues. And I think it's totally fair because we're talking about public health issues, right? Public health. It's a matter of massive amounts of people, right? This is the study of how health is affecting groups, right? Big groups. And so it is. It's who's going to tackle that, right? Like on an individual level, we can't fix neighborhood effects, right? We can't just go in and change entire neighborhoods and revamp and restore entire neighborhoods, right? Who's going to do that? Who's putting money into neighborhoods, right? It's systems, it's governments, which is where the politics come in, but it's other political elements too, banks, investors, just other works projects, companies. Where are companies going? Not that many companies come to these neighborhoods. They end up with local stores or really old chains, and so it's sad to see, but I think you're right. We need to look at this as, at least in part, a political issue that can be addressed through the government, without getting partisan. I think that's fair to say.
Even when we talk about zip codes impact on health outcomes, that already is such a loaded statement, because when we break down zip code, there's the education system, there's, water, sewage, utilities, there's the actual buildings. When were they built? Do they have lead paints or not? There's so many other factors that I can't name off the top of my head now. And when we start talking about how politics, capitalist interests, and personal motives of those who are in power affects each of those building blocks to then affect your health outcome, for me, it's really hard to not feel apathetic almost, because I feel like when growing up, I personally grew up in circumstances where political leaders and even community leaders constantly failed us whenever we had asks for better education, for a safer community, for better public transportation. And growing up with those constant kind of blows, it's hard to not become apathetic. When I think about the relationship between zip code and health now, I realize now more than ever how important it is to have leaders who are actually willing to do the work to heal a community and to, you know, somehow move away from these really racist institutions.
Yeah, I think it's totally fair that a lot of people have lost faith in the government to make the changes that would help these health outcomes that we're seeing that are related to these kind of space-based problems. I think, I think a lot of it, like lobbying the government, can't be a replacement for action, right? We can't just say, hey, government, this neighborhood doesn't have access to clean water. This neighborhood doesn't have access to food, right? They don't have enough food there. Do something, government, right? That might solve the problem like 10 years down the line. It might say, maybe it'll solve the problem a little sooner if you're really optimistic or if you have a really, active government. But a lot of times what's really doing this is food banks, is local nonprofits, right? I worked for a housing nonprofit in Baltimore this summer, and they do a lot of this community investing where they go in, they work with the long-term residents who have been there so that they can make the neighborhood something that benefits them, right? And something that helps them, in terms of health, it helps them stay healthy. And things like getting rid of this lead paint, getting rid of, maybe getting some plumbing into the house to fix the old pipes. Like things like this go a long way to helping health outcomes in neighborhoods, even if you do start on a house-by-house basis. Like we're saying, we can't solve this problem individually, but at the same time, it feels like nothing's getting solved if we don't start on that level. So we just got to keep working, right? We need people to, get involved, talk to people, and, hopefully one by one, we start to see better health outcomes in the future.
Eric, your point, and especially your experience this summer working in Baltimore, shows the importance of investing in your community. Like sometimes when political leaders, well, really mostly when political leaders aren't cutting it, you just have to get down and do the grassroots work and do the community organizing and help the nonprofits and organizations that are already there. And so often, these community organizations are overlooked in terms of donation of time, of money, of other resources. I think it would be nice to look into ways of how we can better invest into our communities as students, beyond the projects and services that we're already doing. And this goes out to our audience too, to look into your community to see what they need from you and what their asks are.
One last thought I want to add is a lot of our health outcomes come from our access to healthcare, right? Access to doctors' offices, hospitals. And I think it's really interesting that a lot of people go into med school, nursing school, and they come out thinking, I want to live in this really nice neighborhood. I want to live in my penthouse. I don't want to live in some poor neighborhood, whatever. And so that really limits the access that people have to healthcare in certain zip codes or certain states. And I don't know if there's anything that's being done to address this. I know my mom has a family friend in Hiroshima in Japan, and they have a program where you can go to med school for a reduced cost, but only if you decide to be a doctor in a rural area. So that's really incentivizing a lot of healthcare workers to be in places that maybe you wouldn't normally be interested in. And I think something like that would be cool here if there hasn't been a program like that already. Just to, I guess, sum up, a lot of issues are involved with the differences in zip code, and it's really hard to slap one solution onto there. But yeah, it's really important to acknowledge, especially in education for future physicians or even public health workers.
The environment can not only affect our physical health, but our mental health as well. Here's an example of how your mental health can be impacted by several components of your neighborhood.
But, I mentioned like chronic stress and living in environments where maybe you don't know where your next meal is going to come from, or if you can feed your family, or if you want to go out and get some exercise, right? Which is a great thing for your health, but you live in a neighborhood with high crime rates and you don't feel safe. that can not only impact your physical health because you're not exercising, but it can also impact your mental health because when you go outside, you don't feel safe. So I feel like pretty much everything can impact your physical and mental health.
I think, like a lot of other health issues, mental health is kind of put on the back burner. Even in environmental health, I think the first thing we think of is water supply, access to food. Like mental health is also a huge part of this, and it's not always um, the centerpiece when we talk about this field.
Yeah, I mean, I think in terms of health, right? Yes, mental health always gets pushed to this side, but even something like stress, right? This is what Dr. Latshaw was stressing, is that stress is a public health problem, right? Stress isn't just something, at least bad stress. There's good stress and bad stress, but too much stress gets to the point where it causes physical health problems. It causes like functional problems if you're too stressed and you can't, get out and do the things you need to do, right? That's a huge problem, right? And it causes problems. It can cause problems for kids. It can cause problems for their parents. It can cause like problems for the community, right? Like what if everyone in the community is super stressed and it's causing all these people to have these same like dysfunctions, and suddenly the neighborhood isn't getting clean because everyone's too stressed out about other things, and all these small things that add up and become these big public health issues. And I think if we don't address things like stress, things like mental health problems as, as a public health problem, then, we'll have to reap the consequences of that, and we'll also just never solve them.
What Eric mentioned is something that is happening in real time. We don't need to bring up these hypothetical ideas when literally, if we look at different communities in Baltimore, we see this happening already. I think it just brings to light how underestimated the impact of stress on our mental health and therefore our overall health is. In addition, politics is a major contributor to how we interact with and affect the environment. Dr. Latshaw mentioned how difficult it is to coordinate our environmental needs with government policies.
It's become politicized, but I almost refuse to accept that because it shouldn't be political, right? Who doesn't want clean air? Who doesn't want clean water? And it's not like we as individuals can go out and get our own clean air, or get our own clean water. Like we can't go to the local incinerator and say, yeah, I don't want you to burn your trash anymore. Only the government has the ability to really regulate the environment.
I like that Dr. Latshaw said, I almost refuse to accept that it is politicized. Because I think that's the right approach, right? I think regardless, right? This is a public health, these problems, all of the environmental health problems are public health problems, right? This is about making sure people are safe and healthy and happy. And that has nothing to do, frankly, that has nothing to do with polarization, at least. And so I think that's the right approach, right? Instead of taking this approach saying us versus them, we have to keep saying, hey, it's all of us versus, disease and these social problems and these environmental problems. And even when people are fighting back against it, keep saying, hey, we know you're part of our team, even if you don't see it that way. And I think, that's a good approach. And I think I just really like that she said that, because while it is politicized and while we do recognize that there's this polarized environment right now, I think we need to continue to recognize and continue to say that it's not a political problem.
I think all of this just goes back to our discussion about how climate change has been politicized. It's interesting. The term is public health. It is the public. And yet people, because of political agendas, because of capitalist interests, have figured out how to make public health so divisive to the point where it's difficult to get any beneficial policies passed that are ultimately going to help you in the end long term.
Yeah, I agree with the both of you. I think it's once money gets involved, it's really hard to make changes because companies, they want to make stuff cheap, but then at what cost? Right? This is like, again, Flint water crisis. They want to save money at the cost of people. A lot of these larger entities are the ones that are that have the hands around climate change and just environmental health in general. And that's something that we need to be mindful of. Lastly, Dr. Latshaw brought up that environmental infrastructure, such as clean water, is not always stable even in developed countries. Here, she voices her concerns regarding the nature of our infrastructure.
Every year, I think it's like the American Society of Civil Engineers puts out like a scorecard and it rates our drinking water infrastructure in the nation. And it's abysmal. But it's not just scary because our drinking water system, is falling apart. But it's also scary because the cost to fix it is just astronomical.
I remember when the three of us moved into our apartments, we were complaining about our water. And I think Eric said every time he turns his water on, it's brown. And that's kind of the most ironic thing about this, is that even though we live in a very developed country, there's still a lot of issues and our infrastructure can be quite fragile sometimes. The first thing that comes to mind is those Russian hacks that affected our oil supply and people went crazy. That could happen to our water, our food, right? So it's really scary to think about infrastructure and how to maintain it when there's so many things involved that can go wrong at one moment.
Oh yeah, I lived through that oil debacle because I was in Georgia. And whenever something happens to our infrastructure where like water is unavailable or electricity or oil, something's unavailable for some amount of time, going outside feels like you are in a literal war zone. And it's terrifying. The feeling that I have no idea when things are going to go back to normal, but people are so chaotic. And then, I can't help but think, but that, like, oh, this was a short-term issue. What am I going to do if it's long-term?
Yeah, I think for me, the key takeaway from this discussion is like how much we just take for granted. And it's like, okay, it's more fragile than I thought. Like, what do we do about that? Like, I don't know. But I think it's super interesting. Yeah, the fact that when we look at developing countries and we say, hey, why don't they just do this? Like, we need to recognize that, we're barely holding it together in a lot of ways in some of our public infrastructure and some of our health systems. I mean, obviously, COVID showed that when we're hit with something bad, when we're hit with a bad wave of something, some of our infrastructure falls apart. Some of the stuff, some of our systems, some of our people, our places, it just isn't enough. And I think that carries over to so many other things. And so just recognizing, how difficult these things are, how hard they are to maintain, how many people are working so hard to make sure that we don't have to think about them every day. It's really just something to be grateful for, I think.
Something interesting that Dr. Latshaw brought up that hits close to home for us, at least, is that when it rains too much, the storm drains overflow and it mixes in with the sewage and it just empties into the inner harbor. And I don't know why that was so shocking to me, but it kind of makes sense now when I think about it. And yeah, our infrastructure can get overwhelmed very easily, even with stuff like a lot of rain. And so, it's very expensive and hard to just say, let's replace all of our infrastructure and make it better, because that's one, very expensive, and you also can't do that for the whole country at the same time.
Now that we've mentioned a few of the prominent issues in the field of environmental health, we next want to discuss what can be done.
To start, Dr. Latshaw mentioned that the field of environmental health is unheard of to many and that more work needs to be done to promote it in education.
Most people, I mean, you don't really ever meet a kid who grows up and says like, I want to work in environmental health, right? It's kind of this like niche area that people don't really learn about. Even the class that we teach at Hopkins, I can't tell you how many times like I hear from students like, oh, I thought this class was going to be about polar bears and, saving the trees. And, it's totally different than what I expected to learn. So we're certainly not doing a good job educating children about environmental health.
I really loved her point about, oh, environment is saving the polar bears, or I need to use reusable straws so that I can save the turtles. But she mentioned that that's pretty artificial when it comes to environmental health, because a lot of these issues revolve around bigger things, larger entities than just the polar bears or the turtles. And a lot of that has to come with education about, environmental health. And I think it's kind of sad that a field important like this is not familiar to a lot of people. And I guess you could promote it in the schooling system to make it more interesting and appealing to people. But I don't know. It's just so weird that this field that's so prominent in our daily lives is not very talked about a lot.
Yeah, I hear this sentiment a lot, right? Like we should be learning about this, right? Like why do we know the mitochondria is the power of the cell? Why do we learn Pythagorean theorem like when we could be learning these useful things? And it's hard because I feel the same way. Like I think more people should be learning about sociology, about psychology. More people should learn about like taxes and responsible finance and things like that. And the question is like, okay, instead of what do we take away? And maybe there are answers to that. But I feel like environmental health is another great, candidate for that kind of discussion where like this is something that affects everybody in the world. This is something that affects our communities locally. This is something that, we can make a difference in. This is something that understanding will help us, take care of our own health, take care of our families. And yet, yeah, it's kind of pushed to the side. It's kind of misunderstood. It's a niche topic. Is there a major? I don't even know if there's a major here at Hopkins for where we have, so many people studying it. And it's just something that needs to be, it's definitely one of those classes where you feel like, yeah, everyone should take this class once, at least. So yeah, I love that she brought this up. So we just looked, and Hopkins does have an environmental science major. And I think it's great that people will learn about, the environment, whether again, that's the natural environment or that's things like neighborhood effects. Because again, that stuff is super important. But I think it's telling that we don't have an environmental health major, more specifically, because I think the way that these things affect our health is, I think, more urgent, more pressing, and maybe even more useful in certain situations. And so, yeah, it just reiterates my point. I really hope that this is something that gets out there and this is something that becomes more popular in the coming years.
Despite the effects we may see from better education, Dr. Latshaw claimed that the best way to see change in environmental health is to appeal to larger governments and organizations through advocacy.
Climate change is probably one of the biggest issues in the field of environmental health. And we're not going to solve climate change by recycling, or by, doing sort of individual type stuff. I mean, it's important to do individual stuff. As much as you can reduce your impact on the planet. Absolutely. But really what we need to do is we need to change policy at a high level. We need the United States to commit to the Paris Climate Agreement, which I think we're redoing, or we're trying to redo. And we need companies to commit to reducing their carbon footprint. And so I think, students have a long history of protesting and advocating and pushing, policymakers and world leaders. And so I think that is really the best place to do that. And if that's overwhelming, it's not like you have to found your own organization to do this. You can sign up to be part of the Sierra Club or the Natural Resources Defense Council, or there's a lot of different groups that are working on these issues. And so if you sign up to join them, then they draft letters and you can sign your name to the letter, or you can sign a petition, or they'll have tweets that you can use and things like that to make it easy for you.
So I know I brought this up earlier about how we think environmental health or just environmental science in general are these little tiny things like recycle or use different straws or whatever. It was kind of a slap in the face when Dr. Latshaw said, yeah, that stuff doesn't really help in the long term. And although it is still good to do your part, it's more of the larger companies, corporations, government systems that are contributing to stuff like climate change and impacting larger health outcomes of different communities. So yeah, this was a really surprising answer, I guess. I expected her to say, oh, you can do this today, right now. But yeah, I think this was a really interesting and thoughtful answer.
Even bigger slap to the face when corporations make promises of sustainability and promoting environmental health and, improving lives, and they find these little loopholes to do the exact opposite, but they get to keep these promises as almost advertising tactics. And then, you have people who are misinformed about just their day-to-day lives.
A key reason that this has become the big change in the way we talk about climate change is because we need large scale change fast. And right, if that wasn't the case, then maybe there would be more pushes to continue this kind of individualized approach. But the only way that we're going to make these really large changes really fast is by appealing to really large and really powerful organizations, right? Governments, corporations. These are people who have it within their power to make changes. A matter of whether they will or not is something else. But it's kind of frustrating because it takes agency out of our hands, right? It's nice to feel like I can recycle and it makes a difference, but when your favorite company that you're buying the things you're recycling from is polluting at the same time, it's counterproductive in the end. It doesn't make a difference because it's being offset by an entity that's much larger than you, and that's frustrating. And so I think it's hard to get people excited and active about this issue because it's stressful and it's scary and it feels like, right, there's this, like we were saying, this big doomsday thing is happening and there's nothing I can do, and that sounds really scary. But the reality is we keep trying, people keep trying, and there still are people who can do things and make differences, and we keep appealing to them, and hopefully things do start to change even more.
I really like that idea because, Dr. Latshaw recommended you can sign a petition or tweet something, but it's like, what am I, a 20-year-old college student, gonna do going up to a large corporation and tell them, hey, stop? It feels so discouraging to do all this yourself. And I even think back to that neighborhood conversation we had earlier. What are those people in those neighborhoods gonna do? How can they make change? And Dr. Latshaw still said, oh, you have to partner with a larger organization or find a larger organization that's willing to help you. And I think that was kind of discouraging to hear because it's, what if they don't want to work with me? What if they don't want to help these people? What can I as an individual do? So yeah, this is a very hard solution, but somehow it needs to be done.
The concept of petitions and the impact of a single person's action is always so intriguing to me because on one side, I do see the thought of what is signing a petition going to do? Like a digital petition. But then on the other side, I can't help but think about there was actually a student from Johns Hopkins who graduated recently. I cannot remember their name for the life of me, but they were able to get petitions and then got Dunkin' Donuts to start introducing plant-based alternatives in terms of the vegan or veggie sausages or patties and stuff. And that was one person, could have been a small group, but it definitely wasn't this big organization going against Dunkin' Donuts to get more plant-based products into their menu. So then I see instances like that and I'm like, well, that started from a petition, at least I think.
I think it's cool though. I think what you're saying, there are ways to right, make a small individual impact, but even that, talking with Dunkin' Donuts about that, hey, look what this does for you, right? It makes your product more sustainable, more attractive. It's a nice PR move. It'll attract more people to your business if they want other options. There are a lot of ways that we can tackle climate change, within the capitalistic corporate system, that most of the world exists under. I think because a lot of these things are good for corporations, like I was saying before, if you, this isn't an us versus them issue, right? This isn't all these people against these health problems, against things like climate change, right? And corporations, if you don't want your coastal locations to be damaged by flooding, then stop polluting. Like help, you can have an impact on this. If you don't want your workers dying and you have to constantly replace them, then you have to, work toward helping the environment. These are, it sounds dystopian, it really does, but to think about people in this kind of exchange way, it's not a good way to think about it. But it was an example of really the way that it's not us versus them, right? This is something that if we, even as individuals, maybe as small groups, talk to these corporations, say, hey, I have an idea for you, and they pitch this to you, maybe these small changes happen, and over time, these things get better.
We hope that this episode empowered you to understand aspects of environmental health and inspired you to learn ways to take care of your surroundings. For more information about ways to promote environmental health in our day-to-day lives, please visit our website withthepodcast.com. To share your thoughts and to interact with us, follow us on Instagram at with_the podcast. We appreciate your support. And thank you to Dr. Latshaw for taking the time to talk with us. We hope you will join us for our next podcast.